Hi, Jennifer Novak, Performance Recovery Coach, here once again to talk to you about foot mechanics and the basketball player. My last video was all about the 4'5", the forefoot prep I do for basketball. Today I'm going to move a little further back on the foot and talk to you about the muscles and the positions that are needed for that rapid change of direction that we all know and love during a basketball game. I brought in my foot model. Here it is, and I'm going to talk to you about what the ankle joint consists of quickly. It's really this tibia, the bigger lower leg bone or the shin, fibula, the smaller bone, and then how they intersect with the talus, which is this bone here that connects with the heel bone or the calcaneus in the back and all the tarsals in the front. But it's this joint right here that is highly involved in change of direction. So what we're going to do is show you some of the lateral ankle muscles that are involved in that, and then some of the medial ones, and then we're actually going to cross the knee joint and deal with a couple of hamstrings because they attach up here to these two bones and become part of that steering mechanism. So I hope you enjoy and stay tuned for the ankle 8. The ankle 8 is a series of 8 exercises designed to work through the foot in both the transverse and the frontal planes, along with a little bit of obliquity. I'm starting with the lateral side of the ankle right now because, as you may or may not know, lateral ankle sprains lead the pack of injuries among basketball players. And if you've had an athlete who's had an ankle sprain, you know that you have to get these lateral muscles strong and responsive again, along with your plantar flexors and dorsiflexors and your gastroc and soleus. So we're here. I've hooked up a band, if you can see. I happen to be on a Cybex Bravo machine, but any kind of cable machine or a squat rack will do. And I hooked up a therapy band to the pole, and we've wrapped it around my athlete's forefoot. And what he's going to do with his foot plantar flexed is he's just going to push out on that band into abduction with his foot pointed and hold for 5 seconds, resting for 5 seconds, and repeating it 5 times. Then we're going to take the ankle into a neutral position, either plantar flexed or dorsiflexed, and repeat the same movement out into abduction, trying to keep the knee stable and moving from the foot. Holding 5, resting 5. The last one is to lift up into dorsiflexion, and when you abduct now, we're going to add some eversion of the foot. It's natural for the foot to do this. Holding again and repeating for 5 repetitions. Here we are on the medial side of the foot and ankle now, and we're going to do the same 3 motions, the same 3 ankle positions. First, we're plantar flexed, wrapping that band around the mid to forefoot, and he's going to move toward the camera into adduction toward the midline of the body and hold, and then pull out of it. Of course, there are 5 seconds on, 5 seconds off, 5 seconds rest. Then in a neutral heel position, and pushing in toward the camera. Note he's going to have a little bit of inversion with this, and that is exactly what you want. The 2 motions are always combined. Coming back, I can tell you need that one, buddy. And then you're going to lift into dorsiflexion and come toward the camera again, and you're going to see even more inversion because that's largely using tibialis anterior, which is a dorsiflexor and inverter of the forefoot. So we've seen 6 of the ankle 8, and now we're going to move up the chain a little bit into some of the steering mechanism for the lower leg and foot. And those are the hamstrings, which actually attach on the back of the tibia and fibula and help the steering mechanism of all of that movement in the frontal and transverse planes. So the way you're going to do this is to use the same band, and we've hooked this around my athlete's heel. And the key is to keep the knee stable and centered, but he's going to move into dorsiflexion and external tibial rotation and lift and pull that heel, pulling that band back in toward his rear end and holding for 5 seconds. You can go ahead and rest. For the medial side, the body position is the same. The knee stays straight up, but we are going to dorsiflex the foot and move the tibia inward, and then lift the heel off the floor and pull that band in with the heel toward the rear end, toward the glutes, and hold. Make sure you have the foot flexed and make sure that you have the heel off the ground as you do this. The use of isometrics with an athlete after a setback helps establish a new baseline for those positions and muscles. I like to call it positional volitional motor control, because many times after a setback, that athlete has to make a conscious choice to do a movement before those movements can be folded back into the dynamic equation and become autonomous and subconscious. So I find I have very good results evaluating a body, seeing what they need, and using these types of isometrics to get them back in the game. Thank you again for watching, and I'll see you again soon.